Welcome to this tutorial from AlliedMatch, your learning and certification partner. In this short guide, we'll show how to perform oral suction using a Laerdal suction machine. This procedure should always be done by trained carers. By the end of this session, you'll be able to explain the purpose of oral suctioning, set up and use the Laerdal suction machine safely, demonstrate correct technique following infection control guidelines, recognize when to stop suctioning and what to report. Let's get started. This is the Laerdal suction unit, a portable device used in hospitals, care homes, and emergency settings. It removes mucus, saliva, and vomit from the airway using controlled suction pressure. Key parts include: operating knob, turns the machine on and adjusts suction pressure. Vacuum indicator lights, show suction strength. Canister, collects secretions. Tubing and Yankauer suction tip, connects the machine to the patient. Battery and power leads, allow for portable or mains use. Always make sure the machine is charged, clean, and has no visible damage before use. Before using the suction unit, ensure the unit is charged, if it is battery operated or connected to the mains DC supply. Inspect the canister, tubing, and connections, ensure no damage, leaks, contamination. Confirm the operating knob is set to 0 OFF before connecting to the patient. Perform the device test if indicated, check occlusions, system integrity. Ensure infection control measures, gloves, apron, eye protection if needed, clean environment. Confirm the correct suction level for the patient. Manufacturer resources for further reference are provided at the end of the course. Let's go through how to use the device, step by step. Step 1. Setup. 1. Assemble canister and attach tubing to patient port and vacuum port. 2. Connect power supply or ensure internal battery is sufficient. 3. Attach patient tubing to the suction catheter and ensure secure connection. Step 2. Selecting suction level. 1. Turn the operating knob from 0 to the desired vacuum setting. 2. The unit can reach high vacuum levels, approximately 500 plus mmHg, and flow greater than 25 L per minute. 3. For pediatric or infant use, here may be a lower suction range and it is color-coded. Performing the suction. Ensure the patient is positioned appropriately, head elevated. Insert the suction catheter as per clinical practice, carefully, to avoid trauma. Engage suction, monitor patient's condition, oxygenation, comfort, vital signs. Use intermittent suctioning, limit each pass as per your local policy. Flush tubing a canister if policy indicates after each use. Ending suction and post-use. Turn operating knob to 0, which is turning it OFF once suctioning is complete. Disconnect tubing from patient, cap as required, or dispose of single-use tubing per infection control. Inspect canister for overflow, condensation, contamination. Clean or disassemble and charge the unit as per manufacturer instruction. Cleaning, disinfection and maintenance. After each patient use, clean and disinfect all reusable parts in line with manufacturer instructions and your organization's policy. Replace disposable canisters, tubing when contamination or blockages occur. Daily or weekly checks, battery status, general device integrity, filter condition. Report any malfunction, for example, failure of device test, persistent alarm or LEDS, to biomedical engineering or the equipment manager. Ensure device is stored in a clean, dry environment and ready for next use. Always remember that thorough rinsing and cleaning the parts are very important prior to disinfection. There are various ways to disinfect the reusable parts as shown in the diagram. Image sourced with thanks from healthandcare.co.uk. There are common issues that you may encounter and that you will need to report. These include: 1. The device will not power on. Check power cord, AC/DC connection, battery. 2. Suction is too low or there is no flow. Check for occlusions in tubing a canister, ensure vacuum selector isn't at 0. 3. Overflow of fluid into pump. Stop use immediately, do not attempt to use until checked. For lead indicates failure mode. Follow the manual's fault conduct and actions. You should escalate if you notice any of the following. 1. Any damage to device housing, cabling or connectors. 2. Repeated failure to achieve desired suction. 3. Evidence of contamination, internal fluid ingress. 4. Unusual noise, overheating or smell from the device. Record keeping and documentation. Log the use of the suction unit, patient identifier, date, time, indication for suctioning, suction level used, duration, outcome. Record device checks and maintenance in equipment logbook. Ensure consumables, that is the canisters and tubing replacements, are recorded. Report any incident and device fault according to your organization's incident reporting policy. Here are some practical tips for care workers. Always keep an alternative suction plan ready in case the unit fails, for example a manual suction device. Familiarize yourself with the control panel in calm time so you can operate confidently in an urgent scenario. Ensure patient comfort, explain to patient what you are doing, where appropriate. Keep spare consumables, tubing, canisters, accessible in your unit or ward. Perform periodic mock drills so that usage becomes familiar and efficient. We are now coming to the end of our tutorial. We have learnt that the Laerdal LSU suction unit is a high-performance portable suction device suitable for airway suctioning. To use it safely, always remember to 1. Perform pre-use checks. 2. Set the correct vacuum level. 3. Suction according to clinical need and monitor the patient. 4. Clean and maintain the device properly. 5. Report any faults promptly. By following this guide, care workers help ensure patient safety, effective airway management and compliance with UK healthcare device standards. We hope you have enjoyed this training. Test your understanding by using our knowledge check quiz.